Be sure to have all of the following items before you begin. 1 multiple dose vial of Lupron or Leuprolide Acetate, 2.8 milliliters. 1 syringe marked in units. Alcohol swabs. Sterile gauze. Safety container. Check that the Lupron or Leuprolide Acetate is clear and colorless. Do not use if the solution is cloudy, discolored, or contains particles. Wash your hands with soap and water and make sure you're working on a clean, flat surface. If using the vial for the first time, using your thumb, flip the protective plastic cap off of the vial of Lupron or Leuprolide Acetate. Wipe the top of the vial with an alcohol swab each time you use Lupron or Leuprolide Acetate. Remove the wrapping from the syringe. Carefully pull or twist off the needle cap. Draw air into the syringe by pulling back the plunger back to the unit mark that corresponds with the dose in units that you have been instructed to take. Place the vial of Lupron or Leuprolide Acetate on a hard, flat surface. Carefully insert the needle through the marked center circle of the rubber stopper into the vial of Lupron or Leuprolide Acetate. Gently press on the syringe plunger. This will allow the air to enter the vial, which makes withdrawing the solution easier. Without removing the needle, invert the vial and slowly pull back the syringe plunger until you have withdrawn the number of units of medication you have been instructed to take. Toward the end of a 2-week period, the amount of medication left in the bottle will be small. Take care to hold the bottle straight and keep the needle tip in liquid while pulling back on the plunger. Keeping the needle in the bottle and the bottle upside down, check for air bubbles in the syringe. If you see any, push the plunger slowly in to push the air bubble back into the bottle. Keep the tip of the needle in the liquid and pull the plunger back to your prescribed number of units. Remove the needle and syringe from the vial. Recap the needle. Choose an injection site as directed by your healthcare provider. Alternate the injection site each day. Clean the recommended injection site with an alcohol swab and let it air dry. Uncap the injection syringe. Hold the syringe in one hand the way you would hold a pencil. With the other hand, pinch the skin around the injection site. Insert the entire length of the needle into the skin at a 45 to 90 degree angle. Once the needle is inserted, you may release the pinched skin and push the plunger in a slow, steady motion until all the medication is injected. Gently withdraw the needle and apply pressure to the injection site with a sterile gauze pad. Discard the used syringe and needle in your safety container.